Well, you may have thought times of wearing a mask were over, but if you're going to a doctor's office or hospital anytime soon, you will be required to wear a mask to help prevent the spread of the flu, COVID-19, and RSV. The policy came back into effect this week as provincial healthcare officials say respiratory illness cases are rising in BC. Dr. Brian Conway, medical director of the Vancouver Infectious Diseases Centre, says reintroducing mask requirements makes sense to him.
We've seen an increase in the number of cases of influenza, RSV, and potentially COVID. They could transmit more easily in healthcare settings. There are more vulnerable people in these settings.
He says BC has already observed a slight increase in RSV among children in a pediatric care setting, and the province is about to reach peak of transmission.
Masks work. They aren't the only thing that we should do. We should get our shots. We should stay home if we're sick. We should wash our hands. All of these habits were not time limited, and we should incorporate them into our lives.
Conway adds that only 1.3 million British Columbians have received the influenza vaccination this season, just 25% of the population.
We have an increase in transmission of influenza in a population that is under-vaccinated.
The new requirements include patients must wear PPE when directed by a healthcare worker during direct patient care. Patients and people accompanying them must wear a medical mask in all emergency departments and waiting rooms. This also applies to visitors to long-term care and seniors' assisted living settings. Not everyone is excited to see the mandate return.
There shouldn't be mask. It should be not mandatory. If you take good care of yourself, you may not have any problem. You don't need mask.
Well, for us older folks, I think we need it.
Floaters.
Like my wife who, has a lung disease.
The mask requirements will reportedly be in effect until the risk decreases, which the ministry expects by spring this year. In Vancouver, Lauren Stallone, City News.